Welcome, everybody. I see everybody is already posting their names and, either neighborhoods or community affiliation where you work in the chat. That's great. Love to see it. I will get us started with a couple of housekeeping items, and then we'll kind of dive in. Got a lot to cover today, so I recognize that there are still folks joining, but want to make sure we're getting started on time. So for those who have not met me, my name is Molly Dubow. I am the manager of advocacy here at the Greater Chicago Food Depository. This is going to be a conversation about the SNAP cuts and our plan for advocacy and collective action. Thank you to all of you who are interested in this topic and this conversation. We are going to be recording this webinar, and so anybody who is not able to join the whole time or is missing part of it, or if you have to bounce early, that is okay. We will be recording it and posting it on our website. That link will likely not be ready until Monday, but it will be ready. And we will also be sending our slides out to everybody who registered. So you might ask that, if it's okay if you forget or if you ask again, but just so you know now off the top, we will be sending the slides, we will be sending the recordings, so don't feel like you need to memorize everything that we go over today. Okay, so as you should hopefully be able to see, the chat is open. There also is a Q&A function that's open. If you have a question that you think might get lost in a chat, feel free to put it in the Q&A. We have staff online right now who are going to try and answer questions as they come up. Anything we can't answer right away, we do have time at the end for questions, but if we run out of time, we will be sure to follow up and try and get as many of your questions answered as they come. Okay, so thank you all so much for doing your chat introductions as we are getting ready to go. The agenda for today, we are going to go over why SNAP matters, right? I totally believe that everybody on this call is already at least somewhat familiar with SNAP and why it matters, but it's always important to ground ourselves in the reason why we're talking about this specific program. Then we're going to move into an overview of the cuts and the consequences of those cuts, anticipated consequences at least. And we'll end on a moment of asking ourselves what's next and how we're going to rise to meet that moment, and saving time for questions at the end. I will say that the information that we're sharing today is very heavy. I recognize that there is a lot happening in the world, a lot that you've been hearing, and this is also going to impact ourselves and our neighbors very significantly. So please take a moment to do what you need to do during the presentation and this conversation. I recognize that it's a lot to process. I'm so thankful for everybody who's here today. We'll touch at the end, but there are things that we can do and are doing to meet this moment. And really the first step is by coming together to learn about what's happening like you all are right now. So thank you again so much for being here. And with that, I'm going to pass the mic to our Vice President of Policy Advocacy and Community Engagement, Danielle Perry.
Thank you, Molly. And thank you everyone for joining. As Molly said, we are almost at 300 people, and I'm seeing the chat come in with nonprofits, organizations in the community that serve folks. I see, Rob Carr from IRMA, see representatives. We are just delighted to see so many people from all over. We know that these changes impact everyone, and so we're grateful to see that, our community is coming together in a moment like this. Again, my name is Danielle Perry. I am the new Vice President of Policy and Advocacy here at the Greater Chicago Food Depository. It's been an exciting roller coaster to join the Food Depository in the last few months as all these changes have started to happen. But I'm grateful for this team, the work that they do, that they have been doing in the community for so long, and to join such a dynamic team at this moment in history. I know we're about to get into some good trouble together, and I'm grateful for everybody who's here serving on this team and has done such great work so far. Want to stop and ground us a second in what's happening. on July 4th, the President of the United States signed what they call the Big Beautiful Bill. And unfortunately, once that happened, our lives changed. We know the safety net as it is now and has been changed. And we want to talk through the changes to SNAP specifically today, but we don't want to act as if this didn't change lots of things. We know that Medicaid is impacted and other social safety net programs were impacted through the bill. But today we're going to go deep on SNAP. And so we will share resources when this is over about other programs that were cut, immigration and how it's impacted, and other resources that can help you think through some other parts of the bill. But today we're going to solely go deeper on SNAP. And I know you're asking yourself, why is a food bank having a webinar on SNAP? What's the correlation and why is this important to us? Molly will speak after me about why this matters to the food bank specifically, but I want to ground us in the mission of the Greater Chicago Food Depository. A few years ago, our mission was to put food in communities where there was need, to make sure people weren't hungry. And the mission shifted recently to being the fact that we want to end hunger. You can't end hunger with the emergency food system alone. It wasn't built to end hunger. It was built to be a support and a part of the system. We know that hunger is created because of root causes like poverty and systemic inequity. And so I'm calling out our mission statement here so that you can see the importance of why we're here in this moment. We know that the safety net and things like SNAP really make a difference for families across this country. And so we, as the Greater Chicago Food Depository, are committed to standing up and fighting for things that we know can change the trajectory of the lives of the people that we serve. And so that is why SNAP is important to us, and SNAP is important to our community and the people who we serve. And so we will continue the fight to not just keep it going, but strengthen it. So in this moment, I wanted to ground us in that fact. We are in this fight together and we take this very seriously. SNAP is a big part of what we do. I'm going to pass it on to Molly to talk about the need as it exists today, why this is so important to us at the food bank because of the numbers that we're going to start seeing as this bill and the changes start to come into play. Thank you guys again.
Thank you, Danielle. As Danielle mentioned, at the Food Depository, we do everything we can to rise to meet the moment of food insecurity and hunger in our communities, but we recognize that a program like SNAP and other social safety net programs are essential to be able to meet the need and to ensure that everybody has the food and, the life that they deserve. So one of the areas in which we really like to highlight here is that there has been, ever since the 2020 pandemic, there has been an elevated amount and level of need across Cook County. And it never really went away, right? So you can see here our graph of FY23, FY24, and FY25. So FY23 was already fairly raised. And then starting in FY24 and FY25, things due to, we saw high food inflation prices. We saw a lot of, instability in the economy, and things really got very expensive. And the level of need expanded greatly and has only been continuing to remain at that elevated level. And that is before any of these cuts kind of come into play, right? And so we like to show this graph, and specifically the 200,000 reference line, which is kind of showcasing how the household visits to pantries over the last year have consistently been at or near 200,000 per month, which used to be a level that was seen as like the ceiling, just an extremely high. And there are months that, as you can tell, have beat it. So just want to really emphasize that even before any of these cuts are going into law and are being enacted and being felt by people, the elevated level of need is already there. So with that being said, it's important that we start this conversation with asking ourselves why SNAP specifically matters. For those who are maybe unfamiliar or unaware, SNAP stands for the Supplemental Nutrition Assistance Program. It is formally known as food stamps, and so that might be how you are familiar with it. It is the primary source of nutrition assistance for almost 2 million people in Illinois and about 1 million households. So in Illinois alone, SNAP has lifted almost 270,000 people above the poverty line, including over 130,000 children. And that was between 2014 and 2018. That number, so something that is really unique about SNAP is that it fluctuates based on need and where the economy is growing or shrinking. So that number has expanded when the economy is worse, and it shrinks when the economy is doing better. Part of the reason for that is SNAP is an economic multiplier. For every dollar spent on SNAP, $1.50 is generated in local economic activity, which benefits local stores and local farmers. And finally, SNAP benefits help reduce the risk of diet-related diseases because it's giving people choice and opportunity to choose different options when they go to the store than they would normally be able to afford. The final sticking point here that we really like to emphasize at the Food Depository is that the level that SNAP is able to help individuals is something that the food bank and food pantries across the country are simply not able to match. For every one meal that any food bank or pantry in the Feeding America food system or charitable food system provides, SNAP is able to provide 9 meals. That is a scale that frankly, food banks are not designed to reach, right? There's no world in which the Greater Chicago Food Depository, which is already one of the largest food banks in the country because of the size of Cook County, can become 9 times bigger, right? So SNAP has a reach that other programs just do not have and won't be able to meet. So with that, I want to pass the mic to my colleague, Beth Kennefic, who is going to go over some federal threats to the safety net and to SNAP specifically. And we are going to leave you with kind of like 3 top line things that you need to know to be able to speak about what's happened, going forward. Again, as a friendly reminder, this recording and these slides will be available to you. So feel free, of course, to ask any questions you have, but just know that if that is your question, they are going to be available to you after this webinar today. With that, I will pass to Beth.
Great. Thank you, Molly. I'm Beth Kennefic. I'm a senior policy advisor with the Greater Chicago Food Depository. And I just wanted to first sort of ground us in what are we talking about, and just acknowledge that there are a couple of different pathways for which we have federal budget changes that threaten the safety net. The first one and the main one we're going to be talking about is federal budget reconciliation. And that is when we have implementing sort of major changes. This is something that is done sort of technically to avoid filibuster, and it gets sort of passed through Congress. And it's something that can only really happen once a year per year. But at the same time, the government still has to fund itself. And so there's federal budget appropriations. The federal fiscal year ends September 30th. And so usually you will see us sort of sending out action alerts and other things trying to get the government funded before that September 30th deadline. And that's where we see things like continuing resolutions and sort of temporary additions to the stuff, as well as potential government shutdowns. Rescissions is something that doesn't talked about very often. It did happen this year. It's when you sort of claw back funding, and that's what we saw with public broadcasting. And then lastly, something we won't touch upon in this, but it's happening in conjunction with everything, is just sort of administrative action. So executive orders, notices of proposed rulemaking, guidance that's coming out. And we're seeing a lot of that, particularly around immigration and access to programs, with the intent of sort of causing and creating a chilling effect. So before we get into the actual cuts themselves, wanted to chat a little bit about the themes that you'll see within those. We use this a lot when we were sort of talking about the advocacy and trying to push back against the changes, but I think it still makes sense in terms of as we look at what actually did pass. And so the three sort of buckets that we can see both in SNAP as well as in Medicaid and some of the other things are what you see there on the left. So the first one was there was a decision, not surprisingly, to really try to prevent cuts from happening immediately and people seeing benefit changes. And instead sort of forcing that decision onto the states to sort of make the states the bad guy in this situation under this guise of saying that states needed to pay their fair share. The other one is around looking at who is worthy of benefits and really perpetuating harmful narratives around folks, particularly immigrant populations. But this also is impacting older adults, people with disabilities, etc. And lastly, which we hear a lot, is sort of waste, fraud, and abuse, and how do we reduce that? And there are ways in which we can make these programs more efficient and run better, but some of the changes that you will see me describe is in fact really things that are changing paperwork barriers and red tape for families, and not actually making the program any more efficient. So what are the changes? As I mentioned, we're focusing on federal budget reconciliation, and as Danielle said, sort of the big beautiful bill, or HR 1. This is what was signed into law on July 4th. If folks have been on our advocacy listserv for a while, this is what we had been really pushing back against over the last couple of months. And as a result, what we're seeing are sort of the largest changes to the social safety net in the program's history. Some may say since welfare reform in 1996, but we're looking at around $200 billion being cut from SNAP and nearly $1 trillion from Medicaid. And as a result, we're going to see food access and healthcare being taken from millions of people, including children, seniors, veterans, and people with disabilities. At the same time, it is important to note that while we are making these very big cuts, this bill is still adding to the national debt and the deficit. So given sort of extension of tax changes and other things, we are seeing about $3.3 trillion over the next year, and a huge sort of shift and change from income from the lowest to the highest. And lastly, in particular, as Danielle mentioned, while this is on SNAP, throughout the whole bill, we are seeing significant changes to immigrant eligibility, some of the most significant since welfare reform in 1996. And so as a result, we know need will surge. And as we sort of stated at the top, given that SNAP is 9 times food banks and the food banks are already sort of at capacity, we're not equipped to fill this gap. So this slide is just looking at a high level of summary of changes. I'm going to go into detail about 2 of these, but wanted to sort of put out there the buckets of which we're seeing the changes to this program. Unlike Medicaid, where changes sort of differed over the course of the different proposals, the SNAP changes actually remain fairly steady from what was originally proposed in the House. And so just at a high level, we know that the SNAP program in Illinois is $4.7 billion in benefits, feeding 1.8 million individuals or 1 million households. So it has a huge impact on the Illinois economy and on our neighbors. At a couple of high level, we're seeing things like cutting SNAP by preventing future updates to benefits. So there's a thing called the Thrifty Food Plan, which is how we sort of determine the monetary amount that SNAP benefits are. There was a big overhaul of the Thrifty Food Plan several years ago, and there weren't actually changes or sort of a rollback of that as we sort of thought there would be. Instead, what they're doing, to that theme of sort of shifting the cost and not cutting benefits immediately, they're saying that the Thrifty Food Plan can't really grow in the future. It can be adjusted to inflation, but their USDA is restricted from making a number of other changes to that food basket. There are also, unfortunately, a lot of rollbacks and changes to legally present immigrants. Just to be perfectly clear, undocumented folks have never been able to access SNAP. And then there are groups of immigrants that who are here legally present that can after a certain number of years. And what they did in this, as well as in Medicaid, is they sort of removed access to folks with humanitarian protections. So asylees, refugees, others, which in this case is just particularly cruel. You know, they are coming here to our country and under the most dire of circumstances. They've always sort of been supported in a bipartisan way, and we're going after folks that you know, survivors of domestic violence, et cetera. And the state estimates this is around 20,000 people will be impacted. Lastly, on this slide, it did eliminate the SNAP nutrition education program that is called Eat, Move, Save in Illinois, and that will unfortunately end at the end of this federal fiscal year, which is September 30th. And there are likely folks on this call that have participated in that or connected to that program, and that is how we had sort of nutrition help for neighbors across the state. We have a much more detailed analysis of this, and I know that's going to get dropped in the chat, where we walk through sort of each of those different changes, talk about how it was before, what the bill exactly is doing, and what our current estimates are of the impact to Illinois. But we do know that these are all estimates. They are pulling from the best of our abilities and looking at other advocates around the country. But we think it's a fairly accurate picture of what we're to expect over the next couple of weeks, months, and years. So the two sort of areas I wanted to dive down a little deeper into were work requirements and then some of the cost shift. So starting with work requirements, unlike Medicaid, SNAP has had sort of work requirements, work registration, other kind of time limit things connected to the program. Medicaid has not. So that is a change that we're also seeing in the Medicaid program, as they now are adding work requirements. In the SNAP program, sort of two things happened at once. One, the ability for states to waive work requirements during periods of high unemployment, insufficient jobs, et cetera. That ability is being restricted and almost eliminated. So currently, Illinois has not asked neighbors to sort of to comply with the 3-month time limit because we've been going through COVID and high unemployment. So at least before COVID and before 2019. So that waiver is in place right now until January 31st, 2026. But we will not be able to extend it past that date because that authority no longer exists. The other change that they made is the sort of to the actual population that's impacted by that work requirement. There's a term called able-bodied adults without dependents, which, you know, people can have their qualms about the actual term. There are definitely able-bodied adults who do have difficulty still working, but that's the term that they use. And what they did to the changes is they are both changing who they consider able-bodied by making older adults up to the age of 65 now need to meet these work requirements, as well as changing what it means to sort of be without a dependent. So previously, if you had a child in the household under the age of 18, everyone was exempt. They've dropped that age down to 14. So if you have a child the age of 15 in your household, you would need to meet this work requirement and otherwise lose SNAP. The other couple of changes that they made was they removed some exemptions that had been passed in a bipartisan manner several years ago for adults experiencing homelessness, veterans, and former foster youth. Those exemptions have also ended. So we're going to see an increase in this sort of ABOD population, to a point where we're looking at around 25% of our entire SNAP caseload in Illinois. Around 450,000 people are going to sort of fall into this new category and may have to have additional administrative barriers, paperwork, other kinds of stuff to retain eligibility. Why we're particularly worried about this is because we know that work can look different to lots of people. In particular, if you think about a minimum wage retail worker who has an inconsistent schedule, they may not get 20 hours a week every week consistently. And so to be able to prove that they've reached 80 hours or let their case member know that their hours have shifted, it just puts a lot of onus on them in an economy that we know is always moving. The other sort of area we wanted to deep dive is this cost shift. This is a little further removed from sort of the immediate impact on people, like work requirements or sort of the paperwork requirements, as we can say. But this one we know that our state is going to feel, and that's where we're going to put a lot of our advocacy efforts around. So SNAP benefits, since the program has been created in 1977 and since pilots were introduced in 1963, have always been 100% federally funded. To Molly's point about it being sort of an economic support system, if the program grows because people are out of work and they are eligible, or the program declines because the economy is going well, it's able to sort of respond to that need. And the federal government, who is able to print money, is able to sort of take on that cost. So as part of this sort of attempt to not cut benefits directly from Congress, they are now saying that states need to take on a portion of that share. And so sort of forcing states into very difficult decisions in order to pick up a cost that they have not had to pick up for 60 plus years. Right now, where the state is and how they're sort of choosing this, we're looking at around $705 million a year just to retain the SNAP program. I'll note that eligibility and benefits themselves have not changed. And so there isn't a lot of wiggle room with which to not pay whatever is the cost shift that we are asked to pay without keeping the program intact. So we could see SNAP programs across the country, unfortunately, end because of these sort of difficult decisions that states are put in. The other sort of change on the cost side is administrative costs. It's always been a 50-50 split. And now states are being asked to sort of shoulder a higher cost. So at the same time that we are getting new benefit costs that are based on how well we administer the program, we are now being asked to administer or have more costs on the administration side. So we're looking right now at around $800 million a year starting in October of 2027. But we do think there are ways in which to get that cost down. And there are things that we can do as advocates to sort of support the program over these next couple of years. Just as a very quick high level, I think probably the number one question that everyone is thinking is, when is all of this going to take effect? Unlike a lot of other parts of the bill, there weren't a lot of what are called effective dates listed in the bill for SNAP. And so because of that, a lot of things are considered sort of happening immediately or upon passage of the bill. And that includes the work reporting, some of the changes to immigrant eligibility, utility deductions, etc. The SNAP Ed funding will go until the end of this federal fiscal year. We, at this moment, still have our statewide work requirement waiver until the end of January. And then these administrative cost changes don't happen until later, 2026 and 2027. But what is being used to determine what that cost share is happening now. There is sort of a need to be thinking about all of these things now, even though some of this stuff happens a little bit later. However, right now, the Illinois Department of Human Services is still analyzing the bill, waiting for further guidance from the federal government before they are implementing changes. So even though things are upon enactment, upon passage, we're in a moment where things are not changing. Which leads us to what are sort of the 3 things to remember from this webinar. The first, this is the largest cut to the SNAP program in history. The program has been around, like I said, since 1977, and we're looking at $200 billion being cut from the program. And as we noted, SNAP feeds 9 compared to 1 from the Feeding America Food Network, so that's a huge deal. For neighbors, there aren't any changes right now. We still advise folks apply to SNAP via ABE, our benefit eligibility system, as they would normally and do so until further information is shared. And I think we hope in concert with all of you that we'll make sure that that information is shared in the most inclusive, transparent, clear way as possible so that we can help neighbors navigate this new system. And lastly, while all of these things are terrible, 200 billion cuts from SNAP is not great. It's cruel. It's really hurting the program. The things with the largest sort of impact and sort of time horizon that we're focusing both our administrative advocacy and advocacy potentially with you all is around work requirements and payment error rates, because those are what we know are leading to what is that percentage and that cost shift. And with that, I think I will turn it back to my colleague to talk a little bit about one of those other pathways.
Thank you so much, Beth. As Beth mentioned at the top of her remarks, budget reconciliation is unfortunately not the only way in which budgetary and programmatic changes can happen to the programs that we care about. On top of budget reconciliation, which is something that is kind of optional that they can do every year, the Congress has to pass a budget or appropriations to keep the government open, right? So this year, or I should say every year, the fiscal year ends on September 30th. The House of Representatives has released a proposal for their version of appropriations, and the Senate has released a separate proposal. In the House proposal, they are requesting a cut to the Women, Infant, and Children program, WIC, by $100 million, which would reduce WIC's fruit and vegetable benefit for young children and breastfeeding mothers and parents. The Senate proposal fully funds WIC, so they are different and would need to be together. You will get an opportunity to send an email to your representative in a few slides to be able to ensure that the Senate version of the appropriations bill is what is passed into law. The House version also considers additional restrictions to SNAP. So Beth just went over all of these cuts that have passed into law. This appropriations bill would consider additional restrictions to what a person can actually purchase when using SNAP dollars. It would allow USDA to pilot a program that would determine like what foods are healthy or unhealthy by nutritional standards, which there's already pilots have been attempted, and the administrative burden on it alone is disastrous. Never mind the dignity, right, of not allowing somebody to choose their own food. And then secondly, this provision would create a Buy American pilot where SNAP recipients could only buy American food, which once again, the administrative burden of trying to determine in a globalized society what is considered American and how you prevent somebody from purchasing something on a program like that is astronomical. Finally, there is a program that food banks utilize called the Emergency Food Assistance Program, or TFAP for short. It is how food banks across the country receive USDA food for, by grants by the government, and it's how the food depository receives about 25% of the food that we are able to distribute. There is a line of funding called storage and distribution, which is specific to be able to purchase things like trucks and refrigerators and things to ensure that any additional food you receive can actually be stored and distributed to the community. They are legally allowed to request up to $100 million in storage and distribution. And this year, the appropriations bill only includes $80 million. This is the same as previous year as well, and the year prior. So this is not a new this is flat funded, but it is still below what we would request for that. Perfect. So I know that this was a lot. I recognize that we all have a lot of questions. You guys have been asking really great questions that I've been trying to answer in the Q&A and the chat. I want us to take a moment to pause, take a breath. The information we've shared is overwhelming. I recognize that it is natural to feel hopeless and to feel overwhelmed. While this outcome is not what we have hoped for, especially after months and months of relentless advocacy, I really do want to take a moment to recognize that all of our tremendous collective efforts were truly not in vain. Our advocacy through, our own coalitions here across the nation, we were able to not only slow down what Congress was trying to do here, but also very crucially shed light on the violent agenda of this bill. And we should collectively be very proud of the work that we were able to accomplish while working together, right? We lost the battle, but the fight to end hunger does not end. And I feel very passionate and very appreciative to be in that fight with all of you. So please take the time that you need to sit with this information, take a break, rest up. This was a major setback in our fight to end hunger, but as long as advocates like you are still pushing, that fight doesn't end. So I'm grateful, again, to be surrounded by so many fearsome advocates. And we're going to take the next few moments to share what the Food Depository has been working on in ways that you can join us in deeper advocacy. So the Greater Chicago Food Depository, in our initial kind of immediate response to the passage of the bill, has been focusing on 3 separate avenues to mobilize to stand up for our neighbors and those who will be most impacted by these cuts. First and foremost, we have worked alongside the state of Illinois as well as really crucial, other state agencies and community-based organizations to create a coordinated response to the crisis that's unfolding. So you'll see a photo here of a roundtable that we hosted with the Lieutenant Governor's office, and that's just one example of events and conversations we've had. We have also begun what we have called our media roadshow. We have been interviewed on TV and in print media and on radio, and have begun to spread the word about the upcoming cuts. More to come on a future slide about ways that you could get involved with any of that, should you be interested. And then finally, we are working and actively deeply engaging our neighbors and partners by gathering input and feedback on both a potential policy agenda for the next calendar year, as well as engagement around our advocacy strategies. I will speak more on this pillar as well on a different slide. So first and foremost, I want to kick us off with some immediate opportunities that we can take action. First, the SNAP storytelling campaign that the Food Depository has launched, which is called I Benefit from SNAP. Personal stories are a really powerful tool in this fight to ensure that people who rely on SNAP are protected in Illinois and that eventually this life-saving program is fully restored. Our elected officials need to hear directly from people and communities who rely on SNAP. We are collecting stories of how SNAP impacts all of our lives. So whether you are a SNAP participant or have been in the past, you're a community organization that centers SNAP participants, you're a local business that receives EBT money or has SNAP participants spending money at your business. Maybe you're a local farmer or you work at a farmer's market, or you could be just somebody who cares about hunger in your community and doesn't want to see this happen. We will continue to amplify these stories both to our elected officials, to the media, and to our broader audience to make sure that we are urging everybody to do everything in their power to protect SNAP recipients. I'm going to post in the chat here a link to this website. I will also be following up with the link to this website, as well as a social media toolkit with graphics and captions that you can use to promote this in newsletters and on social media. Secondly, I mentioned during my brief of the appropriations threat that looms on the House side of things that we have a campaign going where you can email your representative about protecting SNAP or protecting WIC and SNAP choice in the appropriations process that's happening right now, sorry. So you can use this QR code here. I'm also pulling up a link that you can use. And that is going to send an email that has already been written to your representative. If you are not already on our listserv, you will be added. Once you use this QR code, you can unsubscribe from anything we send at any point, but it's a great way to stay involved with future action alerts and to get our monthly legislative updates and invitations to future webinars that we do on these subjects. Awesome. So with that, I am going to pass the mic to my colleague, Angelica Chavez, who is our Director of Community Engagement, and she's going to share a bit about the community engagement work we've been focusing on and making sure our partners and neighbors are informed.
Thank you, Molly. Hi, everyone. I can't see you all, but I'm Angelica Chavez. My pronouns are she, hers, and I'm one of the directors of community engagement. Just briefly, we are a team of 3, and we're excited to work alongside our policy and advocacy team members who you heard speak today to advocate for policies and solutions that are shaped by, for, and with community. Now for this slide, if you're one of our partners doing direct enrollment with neighbors and looking for the latest updates, trainings, etc., or your neighbor, community member looking for enrollment support, please reach out to our team, either by calling the phone numbers, scanning that QR code, and once again, we'll share this information in the follow-up email. But finally, once again, the community engagement team is eager to connect and get to know you all. So I'll pass it back to Molly to share more on how else we can stay connected. Thank you.
Thank you. Okay, so finally, I want to end on a slide here that emphasizes a moment that everybody can come together to join the advocacy movement in a more engaged way if you're interested. So we are launching something called both like our champion advocates and the Speakers Bureau. So what you'll see here is a QR code to a survey. And in the survey, you'll be able to indicate what your interest is. A champion advocate is somebody who would like to receive a training on how to give a 10-minute version of this presentation to your local community, to any volunteer groups that you're in, any civic engagement groups, any local neighborhood associations, wherever you think this information would be useful out in community and you would like to help us deliver the message. You can sign up to become a champion advocate to learn how this information yourself and to learn how to present it. There's also options in here for something called a Speakers Bureau. So if you are a partner site, meaning you are somebody who is a food access partner with the food depository, and you would like to receive media training to be able to speak to the impact of these cuts on your work, you can indicate your interest in this survey. You can also, if you are a neighbor with lived experience using SNAP, or recent lived experience using SNAP and want to be able to speak to the impact of these cuts on your life, you can also indicate that interest there. Both for the Speakers Bureau, the opportunities will be to speak, in public forums, to media, to news stations, radio, print. We're just hoping to get as many people who want to be able to share their story and elevate this story to as many people as possible. You can check more than one box. So if you want to do both the champion advocate and learn how to give this presentation and be trained for media, you can check both. So that is, and as I should mention once again, all of these links will be included in the follow-up email that will likely go out either tomorrow or Monday. So that is the end of kind of our prepared remarks. I do want to again emphasize how grateful I am for the overwhelming interest in the subject, for all of you who have immediately come together and said, I want to learn what's happening. I want to learn how to advocate. Together, we will, not only fight for a better future, we'll get back into the ring and work to ensure that our neighbors, communities, and loved ones are protected from harm. It is an uphill battle, but it is one that has been fought in this country before, and one that we are prepared to continue until all hunger is eradicated. Thank you so much for joining us today and for raising your voice in advocacy. It is only by working together that we can end hunger and create the world that we want to see with equity and justice for all. Thank you all so much.
Thanks,
And we will
Molly. I
take
was going
some
to
time.
address a couple of questions
Yeah, yep, we're gonna
that
take some
we've seen in that live. The first one, there was a question around sort of other child nutrition programs, both with childcare, school meals, summer meals, etc. What was in the reconciliation bill only impacted SNAP. However, a lot of children use their sort of SNAP eligibility to then be eligible for these other programs like school meals. So a decline in children in SNAP will have consequences for these other things. Also, there are other ways in which we are facing federal threats, like Molly said, with the appropriations. And so we are seeing cuts to WIC, the Women, Infant, Children program, in the appropriations process. And then lastly, on the administrative action side, we are seeing a number of notices around immigration access to these programs, including a notice that came out from USDA reclassifying what's considered federal public benefit. Just so everyone knows, from the crux of that, no actual changes were made to the child nutrition programs. School meals still must be allowed regardless of citizenship status. And then other programs are also like WIC and summer EBT are also available regardless of citizenship status. It did reaffirm that states have the ability to sort of make changes to that, but as a whole, the access to those actual programs are not changing at this moment. But we do know just this continued sort of information and things like this, the requests for data and other kinds of stuff will have a chilling effect, and it is sort of up to the family to determine their own risks. A couple of other questions. Someone asked, have we heard of plans to reduce our error rates? This is the $1 million, literally millions of dollars question that we're hearing from states, both state agencies and state advocates across the country, as everyone's really trying to dive back in to a piece of sort of the SNAP quality control program in a way that we haven't done in a very long time. SNAP has always been sort of rigorously evaluated in terms of application timeliness, whether or not applications are reviewed correct and not denied, and then looking at this payment error. So this cost shift is really only looking at payment error. And so there are strategies in which our state is already starting to look through and see what are the cause of those errors and what are ways in which we can try to get those down before they make sort of the final decision on what our cost shift would be. The other couple of questions are around the work requirements and whether or not our current statewide waiver supersedes the federal work requirement. At this point, our waiver is in effect, and it will be in effect until we hear otherwise, and so that's the end of January 31st. But the ability with which this have a statewide waiver beyond that will no longer exist. So states like ours will not be able to have sort of that blanket statewide response. We don't know yet sort of when the USDA will put out guidance sort of saying how the rest of that works. The other question someone asked was about work requirements and December 31st, 2026. That is a correct date, but that is for Medicaid. So the SNAP work requirements, which had already existed, will sort of come back into play sooner than the Medicaid work requirements that have never existed before. And so states have until December 31st, 2026, and then sort of an option to qualify if they're acting within good faith to delay that a little bit further. I think one thing from an advocacy perspective is how do we make sure that both of those work requirements are implemented in a way that they are very consistent across programs, because we know a huge percentage of folks are on both programs. And so if they're going to have to meet work requirements in both, how can the compliance, how they share documents and other kinds of stuff are done in a way that they're very aligned. And then a couple of other questions in terms of the sort of what activities count towards work. Nothing changed in the legislation with respect to that. There are sometimes flexibilities that states have with which how you can define that, and so there may be changes that Illinois makes, but there's nothing being directed from the federal government at this point. And the current activities include work, paid or unpaid, an average of 20 hours per week. Volunteer to take part and comply with SNAP employment and training activities such as basic education, vocational training, work experience, community work fair and earn fair, doing a self-initiated community service, or any combination of above. So these are all things that we'll get into as we know that the state ramps up sort of the reintroduction of this, but what actually counts as work in education has not changed. Doing a quick scan to see if there are any other ones. There's a question from Ruth around folks with SSI and SSDI, and that's something we can connect with you offline. I know at least one friend that's looking into stuff around this, so but we don't have an answer for you right now.
I will say, Eleanor, to your question about what to say to people who are looking to apply to SNAP, we're still saying that like the changes have not begun. And so we still say that people should continue to apply to SNAP like they would normally. IDHS is working diligently to, figure out what the best strategy is in terms of figuring out the work requirements and, other elements that Beth has mentioned. But right now, the advice is to just continue to apply to the program if you're qualified.
Continue to apply, but also think, be prepared if you are on this program and you think you'll fall into these categories, because it is something in the early next year that we'll see some changes. So. And yes, the
Emily,
meeting
yes.
is recorded and there are slides.
Yeah.
As well as all the links we will share after. Someone asked about SNAP employment and training as a provider, what we might expect. I think that's something that we'll check with you after. But like I said, the actual work requirement, what counts, has not changed, and we don't know what that means for the existing sort of SNAP employment and training programs.
Emily, you asked about utility deduction. This is something we're still trying to parse out. So we can follow up when we learn a little bit more about the utility deduction. Yeah. It's okay to stump us if you got good questions.
Yeah, unfortunately, that's one of the ones that is upon bill passage. I think the state is trying to think through. Generally, they have 120 days hold harmless to sort of implement changes. They also haven't received guidance from the federal government. And then there's some questions around sort of how we currently have utility deductions and is what in the bill actually making a change. So like Molly said, that is still an area that we are exploring and would love to connect offline if there are folks that are sort of deep in that space.
Beth, do you see this question? For current SNAP recipients who don't meet future requirements, will they be removed as soon as requirements change, or will they be eligible until it's time for them to renew eligibility?
That's still up in the air. We're trying to figure that out. I think there's a couple of different layers to all of this and how the exemptions work and when the screening and all those things can change. So I don't want to answer in a way that's not accurate at this moment, but that is definitely top of mind.
Thank you. So, and for anybody who is posting their email in the chat, just know that everybody who's registered for this webinar will receive a follow-up email from me once this recording is ready with all of the links and the slide deck and the recording of this webinar. So if you would like to stay in touch with me or anybody at the food depository, you'll have my email that way. But I will also, I'll try and capture as many of your emails as possible too. But that is going to be the best way for you to stay in touch after. Okay. Thank you all so much. This was fantastic. Again, just like the level of interest here, the great questions, the excitement for advocacy, the great conversations in the chat and in the question and answers has all been very motivating for us all here at the Food Depository. So thank you again. I am looking forward to continuing to share space with all of you, and you'll get an email from me in the next day or two, next business day or two, I guess I should say, with the follow-up, with the links and the recording that I promised. But in the meantime, anytime you have a question or you want to get some clarity, or you have thoughts about, advocacy or what you want to do to get the word out about this and advocate for a better, brighter future, please don't hesitate to email me. And I'm looking forward to chatting with you all again soon. Thank you so much.